Hey friends, Jessica here from Northern California, and if you are new to my channel, I am here documenting my breast cancer journey. I was diagnosed with stage 3B breast cancer in November of 2022. I had a radical mastectomy of the left side where they removed my whole left breast and 36 lymph nodes. I went through chemotherapy, radiation. I had a right mastectomy just for peace of mind, prophylactic reasons, and I had an oophorectomy so I would not have to go through the Lupron shot. The way my chemotherapy was delivered is through a port that was placed on the right side. So it was placed right here. You can see the prongs there. I have a scar here, and then I have a scar, you can see the port up here where they insert it in through my jugular vein and down to my heart. I'm here today. I am officially 2 years post chemotherapy, which is a huge milestone to cross. I posted a lot of my journey photos, chemotherapy appointments on Facebook. And this morning, Facebook popped up and said it has been 2 years since finishing chemotherapy. So during chemo, I did lose all of my hair. I lost my eyebrows. I lost my eyelashes. And then, of course, like the rest of my body hair as well, which was great because I didn't have to worry about shaving. I didn't have to worry about tweezing my eyebrows or, of course, the little peach fuzz we get around our upper lip. As you can see, it's already been 2 years. My hair has come back thick, full. I have it in little pigtails because I am working today. But my hair is honestly down to about here now, which is crazy how fast it grew. I don't take any supplements or medications or anything to try and have rapid hair growth. Because of the cancer that I had being estrogen positive, I didn't want to introduce any thing into my body that could have an issue with being in remission. So if you're going through the journey of chemo, or you're starting the journey, my number one recommendation would be to get a chemo port, because it is one poke. It's not a fun poke. It's a pretty large needle, but one poke through here. They put the patch on. All the chemo goes straight to where it needs to be. There is no risk of it getting outside of the area it is supposed to be. Some patients do choose to have an IV put in every time, but it's very risky. If they don't get the needle into the exact vein that they need to, there is a risk of chemo entering your bloodstream, which you definitely do not want. I still have my chemo port because I'm still undergoing infusions. I have 3 to 4 more. And then once those are done, I might have it removed. It's kind of gone back and forth in my mind whether to keep it or not to keep it. Major side effects I had other than hair loss was I did unfortunately gain about 40 pounds during chemo. And that was due to steroids. The nurses were happy about that because if you're sick and losing weight, they do have a lot more of concern. So I gained weight, I lost my hair. I do have lasting effects such as neuropathy in my fingers, and sometimes in my feet, which is just a normal side effect of chemotherapy. I'm a dental hygienist by trade, and so I can do like 1.5 days of doing hygiene before my fingers really do start to bother me. So I do finger stretches just to kind of like make sure that I get blood circulation going to where it needs to be. Other than that, I truly don't have any major side effects. Chemo worked well for me. Like I said, it has been 2 years of finishing chemotherapy. And this time last year, I had about 6 weeks break before I started radiation. So if you're going through this journey, take good care of yourself, embrace the baldness. I did not mind it. I loved it. It scared my kids, but it was a fun adventure to go through. There are times that having all the hair that I have, I'm like, oh my gosh, I miss being bald because I get hot real quick. Hot flashes are no joke. So I hope you are all doing well, and I will make sure to check in soon. Bye.